as the coronavirus pandemic upends all aspects of American life. Our guest today is a state executive on the front lines, Larry Hogan, Maryland's Republican governor. He is chairman of the National Governors Association. Governor Hogan, welcome.
Good morning, Bob. Thanks for having me.
Good morning. So, Governor, what is the latest in Maryland in terms of cases and the death toll?
Well, so we're still kind of climbing that curve in Maryland. We're a couple of weeks behind some of the other states because of some of the early and aggressive action we took. We just surpassed 21,000 cases, and sadly, we just went over 1,000 deaths here in the state. But we're certainly in a much better position than we would have been had we not taken aggressive action.
So you're in a much better position, but are you ready to set a date about reopening your state?
So we laid out a very detailed plan just last week, and we've had a coronavirus response team made up of some of the smartest scientists and epidemiologists and public health officials in our state from places like Johns Hopkins and some of the leaders of this pandemic response really nationally advising us. We developed a plan that took into consideration the president's own coronavirus plan, the NGA plan that we put out the week before for recommendations for all the governors, along with some Hopkins reopening plan and the American Enterprise Institute plan put together by Dr. Scott Gottlieb, who was the former FDA commissioner. And our plan is as soon as we see a flattening or a plateauing of these key numbers like hospitalizations and ICU beds are the things that we're really focused on. The number of cases is going to rise as we do more testing. And sadly, the deaths lag a couple of weeks behind what's actually happening now. So the numbers that we're most closely following on a daily basis are hospitalizations and ICU beds, and we're not seeing as much of a spike. We've had a couple of days up a little bit, but it seems to be leveling out, which is a good sign.
It seems to be leveling out. So you're still in a wait and see period about those metrics?
We're looking at those metrics, and we wanted to make sure that the four kind of key building blocks that we wanted to have in place, we want to make sure we had robust testing, which we have ramped up dramatically. We want to make sure we can do contact tracing. We have enough of a supply of PPE, which has been a difficult thing for most of the states to deal with, and we're constantly bringing in more and more supplies to support our hospitals. And then the last thing we're dealing with is hospital surge, and we've added 6,000 beds to our hospital capacity, and have been acquiring ventilators to make sure that we can be prepared. So those things in place, we have a phased plan to start implementing just as soon as we can, because we're anxious to get our economy back on track and put people back to work, but we want to make sure we do so in a safe, effective, and gradual way.